The discovery of an unexpected dementia risk factor in blood values raises alarming concerns about how hidden dangers in the body may accelerate cognitive decline. While age, genetics, and lifestyle are well-known contributors to dementia, new research suggests that unstable cholesterol levels could pose an even greater threat than previously assumed. The implications of this finding are deeply unsettling, as they indicate that even those who believe they are maintaining a healthy lifestyle could unknowingly be increasing their risk. This research challenges the traditional understanding of cholesterol management and highlights how dangerous fluctuations in these levels could have lasting consequences on brain health. For years, high cholesterol has been regarded as a risk factor for heart disease and stroke, but its direct link to dementia has been largely overlooked. The latest study, conducted by researchers at Monash University in Melbourne, analyzed the blood fat levels of nearly 10,000 participants over a span of up to 11 years. The results were striking. Individuals whose cholesterol levels fluctuated significantly over time had a much higher risk of developing dementia than those with stable cholesterol. Those with the largest variations in total cholesterol saw their dementia risk increase by a staggering 60%, while fluctuating LDL cholesterol levels raised the risk by 48%. Even more concerning is the fact that these fluctuations affected cognitive decline more than the average cholesterol levels themselves. This suggests that the standard approach of merely maintaining acceptable cholesterol levels may be insufficient to prevent neurological deterioration. The mechanisms behind this phenomenon remain unclear, but scientists suspect that repeated fluctuations in cholesterol could severely damage blood vessels in the brain. These swings may trigger chronic inflammation, leading to neuronal damage and ultimately accelerating the onset of dementia. Additionally, cholesterol deposits in the arteries could contribute to atherosclerosis, a condition in which blood vessels become narrowed and hardened, reducing oxygen supply to the brain. Without proper oxygenation, brain cells gradually die off, causing irreversible memory loss and cognitive impairment. If this theory holds, millions of people worldwide may be unknowingly putting themselves at risk simply because they are unaware of the dangers of cholesterol variability. The study's findings also expose a major gap in current medical guidelines. Most doctors focus on keeping cholesterol levels within a recommended range, but they rarely monitor how these levels change over time. A patient whose cholesterol swings between extremes could face a far greater risk than someone with consistently high but stable cholesterol. This means that current treatment strategies, such as dietary adjustments and cholesterol-lowering medications, may not be enough if they do not also aim to minimize fluctuations. Patients who assume they are reducing their dementia risk by taking statins or maintaining a generally healthy diet may still be at significant risk if their cholesterol levels remain unstable. This revelation paints a grim picture for dementia prevention, as it underscores how even seemingly minor biological changes can have devastating long-term effects. Dementia is already one of the most feared and least understood neurological diseases, and its rising prevalence suggests that hidden risk factors like fluctuating cholesterol could be playing a more significant role than previously realized. With dementia cases projected to soar in the coming decades, failing to address this newly discovered risk factor could have catastrophic consequences. If cholesterol variability indeed plays a direct role in cognitive decline, millions of people may be silently moving toward dementia without realizing it. Unfortunately, there is still no clear solution to this problem. Researchers have yet to determine whether stabilizing cholesterol levels can effectively reduce dementia risk, and there are currently no widespread medical recommendations for monitoring cholesterol variability over time. This leaves many people in a vulnerable position, as they may be unable to take action until more definitive guidelines are established. In the meantime, the findings serve as a stark warning. Even those who believe they are managing their cholesterol responsibly may not be as safe as they think. Until more research is conducted, the only defense is greater awareness and closer monitoring of cholesterol fluctuations, as well as ongoing efforts to understand how these variations impact brain health.